Hey everybody, welcome to Pick Dr. Osborne's Brain. Appreciate you tuning in today. We're going to be talking about lipoic acid. If you missed Tuesday's show, it's a crash course on lipoic acid. We talked about what kinds of symptoms a deficiency could cause, what kinds of diseases are associated with lipoic acid, what kinds of things you can use lipoic acid for symptomatically. We discussed doses, we discussed types, we discussed testing, everything you want to know. So if you haven't watched that show, go check it out. We'll put a link in the feed for you to check that show out. But today we'll do Q&As about lipoic acid, and we'll take other Q&As, but we'll prioritize those ones on ALA. Okay, so Mickey's asking, can alpha lipoic acid help with gout? I haven't seen anything ever really, Mickey, clinically where ALA was super critically helpful with gout, and I haven't seen anything in the literature either. Where ALA could be beneficial with someone with gout mainly would just be its anti-inflammatory properties, and so it may have some supportive effect there, but it wouldn't be my primary choice. If you're looking for things to help with gout, really, ultimately you look at B vitamins and vitamin C as much more important roles in helping with uric acid. You also look at diet change as well, because gout is uric acid crystallization in the joint. Let's see, R alpha lipoic acid and S alpha lipoic acid. What's the difference in the structure and the effect on the body? I mean, the biggest difference is the body can absorb R alpha lipoic acid better. And in that regard, a lot of people look for the R form. The difference between the two is mainly R form is natural, better absorbed by the body. All the research on lipoic acid in terms of, everything we showed you earlier this week in research studies were both what's called dioctic acid, which is a racemic mixture or combination of R of both forms. And so we know that mixture works really well because there's so much research documenting that. But some people want to go for just the pure R form, and that's fine. You're going to pay a lot more money for the R form. And is it more effective? And I don't think there's any human trials that show that R form is more effective than the other. And so from my perspective, I just like using dioctic acid or just straight up lipoic acid because it's cheaper and it's effective. So, it would be a very different story if the R form were more effective and proven to be more effective clinically and had the same cost. And I would say, you have to consider those factors. It was recommended to use ALA with bromelain to reduce the risk of blood clotting and also against inflammation. Any possible recommended dosages? It just depends. I mean, good therapeutic dosing with alpha lipoic acid starts in the neighborhood of 400 to 1200 milligrams per day. So look at in those doses in an alignment. And if it was recommended, you can talk with your doctor, if your doctor's the one that recommended it, but those are typically standard therapeutic doses. If my foot neuropathy isn't associated with diabetes, can ALA, lipoic acid, still help heal it over time? Possibly. It helps with nerve regenerative repair. Remember, one of the functions of ALA is that it regenerates CoQ10, it regenerates vitamin C and glutathione, and it preserves vitamin E. And those antioxidants are super powerful at helping support nerve recovery. So it's very possible. I mean, I've seen people with non-diabetic neuropathy do really, really well. I actually had a case last year of a man with what was probably more associated with gluten. So he had a gluten-induced neuropathy, because gluten can cause neuropathy as much as diabetes can, and ALA worked extremely well in getting his neuropathy to resolve. Would alpha lipoic acid be an appropriate supplement for a type 1 diabetic that is not on a gluten grain-free diet? You could, and you might get some benefit, Diana, in those type 1 diabetics, because again, what is lipoic acid do in humans? It helps increase or improve insulin sensitivity. So it may reduce the type 1 diabetics' need for insulin dosing. It's not going to make him not need the insulin, but it may help him reduce his total quantity of insulin that's necessary, because it improves how the cells in the insulin communicate. It also can lower blood glucose. So if he's going to take it, he just needs to make sure, I say he or she, needs to make sure that they're monitoring their blood sugar and their insulin, so that they don't end up with a hypoglycemic spell that gets them in trouble. I took your INA testing. I take 2 of your omega supplements daily and eat salmon twice a week, but 2 of the omegas on the test still came out borderline. Any recommendations? Yeah, take 3 grams a day instead of 2, or eat much more salmon. If you're only eating it twice a week, it's not a tremendous amount of EPA or DHA omega-3 in salmon twice a week. But if you're eating it daily, that would do the trick, or just taking a 3rd capsule. 3 grams in total. Let's see here. Please discuss timing of taking ALA, morning, evening, with food, without food, other supplements that may interfere. So timing is not as important as split dosing. So if you're trying to take therapeutic dosing of ALA, let's say, for example, you're taking 800 milligrams a day, take 400 early and 400 afternoon or evening. So that's timing. As far as with or without food, either. You can take it with or without food. The critical element there from the food perspective is, does it make your stomach upset? Because if it makes your stomach upset, taking it with food can alleviate that potential problem. But as far as is it more effective with or without food? No, neither. And does it interfere with other supplements? There's some preliminary evidence in vitro that shows that high doses of ALA may deplete biotin. Biotin is vitamin B7, which is a B vitamin that helps your skin and your hair and your nails grow and stay healthy. It also helps you metabolize energy from fat. And so high doses of ALA potentially, theoretically, could deplete biotin. If you look at, that's why our Alpha Max formula, if you've looked at our formula of alpha lipoic acid, contains biotin in it. It's there on purpose to offset that potential. But is it going to interfere with, other nutrients? No, not so much. Not that we're aware of. The biggest thing is if you're on medications that lower blood sugar, diabetic medications, just be careful, because if ALA improves your insulin sensitivity and your blood glucose levels, the medicines may become stronger, or at least too strong, and can cause your sugar to drop lower, and that might create some side effects for you. So it's more medicine than other nutrients. Does it interfere with biotin or B vitamin? So I think I just answered that one. Does lipoic acid interfere with biotin? Theoretically, yes. No human studies have shown that, and I haven't seen that to be tremendously true. But if we're trying to err on the side of caution, again, taking biotin with ALA. A lot of you may be buying, lipoic acid, just from an online store, and it's just maybe pure alpha lipoic acid with no biotin. You might consider using biotin if you're doing that as an add-on. You can use our formula, and it has the biotin with it. Can I take alpha lipoic acid with lysine? Yeah, you can. If you're going to take high doses of lysine, though, just be aware that you can impact arginine. Now, arginine is an amino acid that helps to dilate your blood vessels. And if you watched Tuesday's show, we talked about lipoic acid having an impact on nitric oxide production as well. And so when you're taking lysine, it has a competitive nature with arginine, which is what helps you make nitric oxide, which is what helps you vasodilate. So just be aware of that if you're going to take lysine at high doses for long periods of time. And if your naturopath is recommending high-dose lysine because you have cytomegalovirus markers, talk to them about it, because again, that higher dose could deplete your arginine and create a vasoconstriction problem, which can lead to your tissues getting less blood and less oxygen and less nutrients. Can you combine CoQ10 with alpha lipoic acid? Yeah, it's actually a very good combination. We like that combination because the two are synergistic with one another. Does ALA help with reducing cobalt and chromium levels? So, I mean, why would you want to reduce cobalt and chromium unless you're getting exposed to toxic varieties of those things? If we're talking about natural chromium-3, not the kind that you may have watched if you've watched the movie Aaron Brockovich and all the people being poisoned by hexavalent chromium. That's a different type of chromium. It's very toxic to humans, but trivalent chromium or chromium-3 is not, so you don't necessarily need to chelate it out. ALA chelates more than anything copper, iron, lead, and mercury than it does, say, cobalt or chromium. But I can't understand why you'd want to chelate cobalt out of you. Oh, so I see. You've got a metal hip replacement. Look, if you're concerned by the metal in your hip replacement, do two things. Number one, get a test. And I recommend any of you doing surgery, talk to your surgeon about material testing, what's called biocompatibility testing. A lot of dentists are doing biocompatibility testing with fillings and with surgical implements like tooth implants, etc. A lot of the orthopedics, though, haven't caught on to this yet. They're not quite doing that, but you can ask because you can be tested for sensitivity to different types of materials found in surgical implants that, a surgeon's wanting to put in your body. So if you're, for example, going to have a hip replacement, or you're going to have a knee replacement, or a dental implant, or a hernia mesh installed, get what's called biocompatibility testing done on what they want to use with you, so that they don't put something in your body that you're going to have an immune response against and create a complication for you. So it's called biocompatibility testing. The second part of that question is, or the second aspect of that question is, if you're worried about the metal from your hip replacement becoming a problem, then get tested for those metals. And you can be tested for the metal leaching to see if it's a problem, in which case some chelation might be a good idea. But ALA, again, not the most effective for chromium or cobalt. There are other chelators that are better suited for that. Where country is your alpha lipoic acid sourced from? The US. Can you take alpha lipoic acid when you have iron deficiency, low ferritin, afraid ALA removes iron? You can take ALA when you have an iron deficiency. ALA at high doses does not cause iron deficiency so much. But I would take those separate from one another, meaning don't take your iron concomitantly with your alpha lipoic acid. Take them separately apart from each other. And have your, if you're worried about it too, have your iron levels monitored. If you're taking, alpha lipoic acid over long periods of time and you have that as a concern. How long can we take it? Do we need to take breaks? No, not necessarily. Alpha lipoic acid, remember, is also found in foods. It's very natural. There's no long-term negative consequence unless you just find that you react to it. Sometimes we'll find that people that react to lipoic acid in a negative way are in mold, and that's one of the reasons why. Is lipoic acid's great. It's great at helping the liver to detoxify, and when somebody's in existing mold, ALA can ramp up that detoxification pathway, and it can create what's called a Herxheimer response, or a detox reaction. And so some people that are in mold, try to start taking ALA, and they're like, why do I feel awful when I take this supplement? This is a clue in that maybe you ought to look to see if you are living in mold. Difference with glutathione, it's a very different substance. You should go back and watch my crash course on glutathione from a few weeks ago. ALA regenerates glutathione, but they're very different things. Glutathione is a tripeptide. ALA is a nutrient-like substance involved in glutathione regeneration and preservation, but they're not the same thing. What type of form is injectable ALA? Depends on the doctor that is injecting it. You can get injectable R form. You can get injectable straight lipoic acid as well. Can you see here? Are there any benefits to use ALA or other nutrient antioxidants for people who had a stroke? Stroke had affected cerebellum, occipital, and thalamus areas. Potentially, yes. I mean, what causes stroke? Stroke is generally a vascular illness. And so what causes vascular inflammation? Lots of things. Heavy metals can cause vascular inflammation. The wrong food, processed chemicals can cause vascular inflammation. And ALA helps the body defend itself from toxins that drive inflammation, no matter what the tissue. So if the tissue is blood vessels, hence stroke, could ALA be potentially helpful? Yes. Is there any fantastic literature or medical research on ALA improving stroke outcomes? Not to my knowledge, at least not a robust body, but that doesn't mean it might not be helpful. I've been taking ALA for over a year now. Started it for POTS, but from what I was able to hear on Tuesday, it's helping loads more. Yep, no question there, just commentary, absolutely. Questions about ALA and cervical stenosis. So can ALA help cervical stenosis? Probably not directly. Cervical stenosis, depending on which kind of cervical stenosis, are you talking about central canal stenosis or are you talking about lateral canal stenosis? Central canal stenosis in the cervical spine generally has to do with poor posture over time, increasing the thickening of the ligament that runs along the back side of your spine, of your spinal canal, your central spinal canal. And so that's something that good chiropractic care, good physical therapy could be super helpful for postural changes, etc. If you're talking about lateral recess stenosis of the cervical spine, where you have neurological impingement, it depends on why it's there. I mean, that can be caused from many, many reasons, but one of the reasons can be generalized inflammation. And so ALA may have benefit in that regard. But it's not going to fix a physical stenosis, like if you've got a herniated disc or if you've got a major ligamentum flavum thickening in the spine. Let's see here. Can I take ALA every day and how long? Generally, yes, you could take it every day. How long? As long as you'd like to, provided you tolerate it. And again, if you want to just play it cautious, you can have your doctor monitor your biotin over time and make sure you're not creating or driving a biotin deficiency, or you could take supplemental biotin as a preventative. But yeah, there's no research on ALA being toxic or dangerous. The side effect profile is super low. Can alcoholics take ALA? Alcoholics should take ALA, in my opinion, Patricia. There's some phenomenal research on lipoic acid reversing fatty liver. And so there's generally alcoholic fatty liver disease, and then there's what's called non-alcoholic fatty liver disease. And there's human research on both, right? Where ALA is extremely helpful at reversing the clinical manifestations of fatty liver disease in alcoholics, but also in non-alcoholics with non-alcoholic fatty liver disease. So if you've got a fatty liver, to me, fatty liver, you should be taking ALA. And then you should be asking the secondary question, which is, why do I have a fatty liver? Because there are triggers for fatty liver. ALA deficiency is not a trigger for fatty liver. ALA is a therapeutic for fatty liver, but it's not the reason people develop it. I mean, the biggest reasons we see people develop fatty liver outside of alcohol are polypharmacy. So, a lot of folks in the US are on 5 or more medications that are processed by the liver, and that's hard on the liver. You're going to create long-term potential liver struggle with that can contribute to fatty liverness. But also we'll see gluten. Gluten's a major trigger for fatty liver disease, choline deficiency, inositol deficiency, B vitamin deficiency can all contribute to fatty liver problems as well. So you should be having all of those things looked at. How would ALA affect someone on blood thinners? It's fine. It's fine. There's no contraindication in taking ALA with also taking blood thinners. But Linda, I would encourage you to figure out a long game strategy on why you need blood thinners. Most doctors will give blood thinners because a person has a history of stroke or heart attack, or they've had a stent placed. But what causes all that, right? What causes the blood to become thick? Not a deficiency of blood thinners. What causes the blood to become thick is inflammation. So what are your inflammatory triggers? Figure them out so that you know how you can be empowered to take better actions so that you're not necessarily required to be on a blood thinner the rest of your life. Those drugs don't come without consequence. Some of them block your vitamin K, which isn't good. And many of them can cause blood to become too thin, which a lot of times leads to pulling of blood. You get leakage across blood vessels, and you get, pulled bruises, and your fragility of capillaries starts to set in. And those aren't good things either. Is R lipoic acid better than alpha? No, in my opinion, no. Is clinically no. I don't see a difference. The difference is if you're using R form, you can use it at lower doses, but it costs more. If you're using regular lipoic acid, it costs less, but you use it at higher doses. So if you're going to use 400 milligrams, for example, of lipoic acid, you might only need 200 milligrams of R form. But if the cost is the same, then what's the difference? Should you take alpha lipoic acid if you're deficient in lipoic acid, but are also deficiency in copper and are supplementing for that? Yes. You should take both. If you're low in both, you should take both. Let's go down in the middle. If you have stomach sensitivities, can there be an issue with taking ALA on an empty stomach? Everyone's different, Christina. I personally take it on an empty stomach. It's one of the supplements I like to take when I've elevated my training. So those of you that exercise aggressively, we like antioxidants when we exercise aggressively, because exercise depletes antioxidants. And depleted antioxidants makes it harder to recover, makes you more tired, makes you age more aggressively, and ultimately creates the potential for exercise-induced fatigue or overtraining syndromes. And so if you're training hard, ALA is a good idea. Now, whether you can take it on a full stomach or not, try it out. Everyone's different. Do you recommend taking ALA as a daily supplement? And if so, would you recommend this? So instances where I would recommend ALA, like where would we say, okay, take ALA every day? Let's see here. It's on the leg. Here we go. Where's my pen? So if you are diagnosed with fatty liver, if you are diagnosed with diabetes, if you have metabolic syndrome, if you are aggressive athlete, training extra hours, doing more for your body. These are all instances where I would say it's probably a smart idea to take ALA because of its known benefits in human research studies with these situations. If you don't have those particular situations, then do you need ALA every day? Probably not. Could you take it? Could you take more of it? Sure, you can. Will it hurt you? No. How do you justify the expense? You know, I like to test. And so when people say, should I take something every day? My answer is test, don't guess. Because testing is going to give you an understanding of what you're low in. And then from there, it's going to give you a blueprint of what might be the best for you as a unique person. Because there's no such thing as a one size fits all approach when it comes to, you know, to supplementation. And by the time you go through all the different nutrients and possible supplements you could take, every one of them sounds fantastic and amazing and sounds like I need to be on that one and I need to be on this one for whatever reason, you know, you're finding the benefit from. So testing allows you to really pick and choose what you need versus what you speculate might be beneficial. And so in the long run, when you test, it's just so much less expensive. What does high dose ALA mean? If you're on 800 milligrams plus per day, that's generally considered higher dose. Remember, from a food source, you're lucky to get 5 milligrams a day. So if you're talking about therapeutic dosing, you know, hundreds of milligrams per day, definitely higher dose. Yeah, love all these wonderful comments about just appreciation. That makes my day. Rainey says, thanks for all you do. How can I schedule consultation with you on what to do for chemotherapy? Rainey, call my office. We'll put a number up for you and you can reach out and get something on the books. Can you take ALA with amino acids, as those are usually recommended to take on their own? You can. There's no competition between ALA and amino acids. The reason why most people recommend that you take amino acids without food is because if you take a bunch of protein with amino acids, the protein competes with the amino acids for absorption, or can. And so amino acids in an ideal world, take those on an empty stomach, or you take them away from proteins. Like if you wanted to eat a banana and take some amino acids, there's no real problem in doing so. And the same thing with ALA. If you want to take ALA with your amino acids, there's no competition between the two. In your opinion, could accidental exposure to gluten result in elevated ALT? Yes. Not in my opinion. I've seen it. I've seen it happen to people where liver enzyme elevations occur as a result of gluten exposure. So definitely that's a possibility. Is it bad to take amino acids if you have gout? No, not at all. Let's see. I've been on... I'm not sure I understand your question, Tony. I don't know if you've misspelled some things. I've been on, you mean clonazepam for years and weaned myself down from 1 to 1/8 over the period of 4 years, and now have myoclonus, stopped taking the benzo. Now I'm on Keppra. Can this help? It's too complex of a question because there's a lot of potential reasons why you might have developed myoclonus. Why were you on the drugs in the first place? You know, there's a whole history there, rich history of facts that matter. And it's really hard for me to give you an answer one way or the other. I mean, I would encourage you to have a more detailed conversation with your prescribing doctor. Does ALA break a fast? No. It's non-caloric, so in that regard, no, it doesn't break a fast. I was taking ALA, ran into some issues. I always wake up and my arms feel dead as if all the blood is drained from them. Happens every time I take it. Any thoughts? Check your home for mold. If you're in Orlando, you're in a humid climate, in a swampy climate, and check your home for mold. A lot of places in Florida have mold issues. Natural supplements for dry mouth. I think if you've got Sjogren's, Lorinda, you need to figure out why you have Sjogren's. There's not a supplement that fixes Sjogren's, but there are behaviors that can modify it. And so remember, what are the 4 fundamental categorical triggers for autoimmunity? Food, chemical exposure, microbial imbalance, and nutritional deficiencies. So start there. Get those things tested so that you have a better idea, so that you're not trying to symptomatically reduce symptoms of an autoimmune problem. The best way to take Alpha Max with or without food, either or, Jessica, either or. You could take it with or without food. If it makes your stomach upset, take it with food. I tested positive for gluten sensitivity and eliminated grains from my diet, but curious, should I take Gluten Shield with all my meals and will it help heal the gut? You can, Jim. You don't necessarily have to. If your diet's dialed in, the point of Gluten Shield is to offer up some degree of protection when you're out traveling, eating out, eating other people's food, where you think you're eating right, but there's the potential for cross-contamination, and it's to give you a layer of protection. Now, some people use Gluten Shield because it helps them just digest their food better. Remember, it's also a broad spectrum enzyme formula. And so if you struggle with any kind of gastrointestinal bloating or indigestion, you might find that it's helpful in that regard. But if your diet's dialed in and your gut's doing well and you're digesting well, do you need to add extra Gluten Shield into your repertoire? No, not necessarily. Can you take, see, I answered that one. Let's scroll down on the middle there. I think I answered that one. Will ALA help against high liver values? Yes, it absolutely can. If you're struggling with high liver enzyme values on your blood work, taking ALA, as I mentioned earlier, if we talk about who should take ALA for best benefits, people with fatty liver, people with liver damage can definitely take it. It absolutely helps. It has a liver protective effect. And there's a lot of good human research data on that. I've seen that be the case in my practice as well. Over long-term supplementation, any concerns about depleting methyl group stores from the liver? I haven't seen that be the case, and we measure that in our practice. So I've had people on long, 6+ months of ALA and not seen depletion of methyl be a particular problem. Now, in theory, there are some biochemistry potentials there where taking TMG might be helpful, but I have not seen that really play out clinically. Levels of cobalt have been high from my hip replacement. Within a year, my health went downhill. Cobalt causes low thyroid. I lost 25 pounds in 3 months and started falling asleep. You need to talk to your surgeon, because if you're reacting to the cobalt in the implant itself, I mean, your body's attacking the implant. That's not going to play out well over years. I don't know what the type of hip replacement you've had, or there are different varieties and different surgical types, but you need to talk to your surgeon about, is it worthwhile exploring another replacement where you get something in there that your body's not going to react to? How do you test for ALA deficiency? INA, intracellular nutrient analysis. Mandy, it's an outcomes test that measures functionality of cells as a result of whether or not there's enough ALA present. Can we put a link up for Mandy on the INA? If your inflammation is high, according to a CRP test, would it be more helpful taking higher doses of ALA than the recommended normal dose? You could take ALA for CRP elevations, Christina, but fundamentally, why is your CRP high? Remember, folks, the difference between functional approach and allopathic approach. Many of you are trying to take an allopathic approach, which is what? See symptoms, treat symptoms. Now, in medicine, symptoms are treated with synthetic chemical drugs that are patented. In green medicine, symptoms are treated with natural substances that have some type of beneficial outcome or effect. But at the end of the day, why is your CRP elevated? You're inflamed. Why are you inflamed? Are you inflamed because your ALA is low? That's a possibility, in which case taking ALA would be the right step. But are you inflamed because of your diet? Are you inflamed because of your behaviors, because of your choices? These are things that you need to explore, because taking ALA to basically to ignore things that you're doing that are bad for your body isn't going to work out well in the long run for you. It doesn't work out any well than taking medicines for symptoms. So don't fall into the green medicine trap. That trap is, don't try to suppress your symptoms with natural things. Find out why your symptoms exist. You can use natural things to support you, but don't use natural things to ignore the underlying core reason as to why the problem exists. That's where you get in trouble. Should you take ALA if you don't have a gallbladder? If you don't have a gallbladder, Mickey, it's very possible that your liver's broken of a sort, because most people with a history of a gallbladder surgery have had that gallbladder removed because of inflammation in the liver. So it's possible that it could be very helpful in that regard. But again, going back to green medicine, do you take it to take it just because? Is your liver damaged? Have you had a liver ultrasound to indicate the health of your liver? Have you had liver enzymes tests done in your bloodstream to determine if your liver functionality is waning? I think all those are important things to investigate. What nutrients are commonly depleted in long COVID? All of them, for the most part. I mean, long COVID is chronic inflammation, and anytime you have chronic inflammation, you have a pathway of problems that come along with that. So if we're chronic inflammation, we'll just abbreviate that as CI, is going to create cytokine increases. These are chemicals produced by your white blood cells that drive up inflammation. So increases in cytokine cause increased chronic inflammation. And so it becomes a self-feeding cycle. But one of the other things that happens in chronic inflammation is increases in cortisol. Your body tries to fight inflammation by producing more cortisol. And cortisol has some long-term side effects. So if we're talking about chronicity, and can we still see the screen?
Yes.
Okay, so cortisol is going to drive up blood glucose. It's going to drive up blood pressure. It's going to reduce muscle and bone. So it's going to start causing you to break down your muscle and bone tissue, because cortisol is a catabolic steroid. And so, and cortisol also depletes, so reduces vitamin C, vitamin D, calcium, magnesium, zinc, for starters. And then the increased inflammation puts more pressure and more stress on your antioxidant systems. So all your antioxidants become taxed, because your antioxidants are there to try to protect you from the inflammation. So antioxidants our pressures put on those, and those start to reduce. So we say what nutrient deficiencies occur in the case of chronic long COVID or any form or measure of chronic inflammation. It's all of them. And it's because of the inflammatory process and the stress that it puts on the body biochemically to need more nutrients to accommodate the damage that's being caused as a result of the inflammation that's happening. Do you know when your food sensitivity test will be back in stock? I ordered several weeks ago and I'm excited to get it done. It's probably already back in stock, Anna, but I mean, the best way to know that for sure is to reach out to customer service, glutenology@gmail.com, and they can answer that question better than I can. Have you done a show on long COVID? I haven't. Because anytime we talk about that illness, you know, we get punished tremendously and YouTube takes everything down and cancels everything that we do. At the end of the day, if you want the short of it all, people with long COVID are living in mold. I mean, I've seen 100 cases in the last few years that are actually, long COVID is actually mold toxicity in disguise. And it's poor diet in disguise too, but mostly mold. So if you've got long COVID and you're really struggling, you need to find yourself a forensic mold investigator to come out to your house and rule out the presence of toxic mold in your environment. Is it okay to take vitamin C with ALA? Yeah, it's perfectly fine. Which prebiotic is best to lower basic? I can't understand your question. There's too much. There's too many words there that don't make sense. Much appreciated. Let's see. Can you go down a little bit? Okay. Right. Oh, too far. Go back up just a little more. Yeah, there we go. What's the best supplement for controlling tremors and Parkinson's? It depends on why the tremors are there. A lot of Parkinson's diagnosis is subjective diagnosis. In other words, there's no great biochemical test that says you have Parkinson's. It's just doctor's observation and suspicion that something is Parkinson's. And so what does that mean? That means biochemically there are 1,000 different potential possibilities to why your symptoms might exist. So that goes back to what is Parkinson's? It's an autoimmune inflammatory condition. What are the triggers for autoimmune inflammation? Food, chemicals, microbial imbalance, and nutritional deficiencies. You should have those things measured, Lorraine, to get to the answer of your question. Now, if you want kind of a surface answer to the question, is one of the things that I have seen commonly in Parkinson's is vitamin B1 deficiency. Very, very common to see B1 deficiency. You need vitamin B1 for proper neurological communication and function. And so a lot of people with B1 deficiency develop tremors that look like Parkinson's symptoms. So that could be something you want to look into as well. Does ALA help diabetics reduce A1C levels? And if so, what dose? Yes, Phil talked a lot about this on Tuesday and showed the human trials and research on this topic. So I'd encourage you to go back and watch Tuesday's show. But 800 milligrams a day is a great place to start. Are there contraindications when taking ALA if your kidney numbers are off? No. I would argue that there's some potential for kidney protection using ALA, but there's no contraindication in using it with kidney issues. I understand that your supplements are very high quality. So was wondering, as far as ALA, is there usually a big difference between your ALA and others on the market? I can't speak for other companies. All I can tell you, Christina, is the supplement industry is rife with corruption. There are crummy Chinese knockoff products. A lot of companies will source, crummy ingredients from China companies that have contaminations of heavy metals or other types of toxins in them. And so what we strive to do at Gluten Free Society is we strive to do one, single ingredients. When we create a product, we bring in single ingredients, and we source single ingredients from trusted sources, and then when we bring those into our facility, we have them tested. We have them tested for contaminants, for toxins, for heavy metals, for microbial issues, etc. Not everyone does that. And to me, that's a big issue in terms of safety. You want to get what you think you're getting. The other thing is we have what's called deterioration testing on all of our products. And not all companies do this either. By the FDA's standard, all supplement have to either have what's called a born-on date or an expiration date. We believe in the expiration date. We like an expiration date because what we do in our facility is we have a special room set aside for our products, where if we have a product that has a two-year shelf life, like let's use ALA as an example, we'll take that ALA, we'll put, from the batch that we just produced, we'll put one of those bottles on the shelf and in a special storage room, and we'll come back later, 6 months later, and we'll test that product and make sure, does it still meet label claim? Label claim is if I tell you one of my products has 400 milligrams of alpha lipoic acid in it, then that claim is based on the date of expiration, not based on the born-on date. A lot of companies will say, we have 400 milligrams of this product, but you have to understand when a product sits on a shelf for a year or 2 years and it's not being sold, there's a deterioration that occurs over time. And so let's say that you get that product and 50% of it deteriorated and you just got it. And so now you think you're taking 400 milligrams, but you're actually taking 200 milligrams. Well, we don't allow that to happen because our products dosing is based on 2 years. So we actually test our products after holding on to them for 2 years to make sure they still match label claim, which means what we have to do when we're making a product is we have to put what's called overage in our products, where we put more than actually 400 milligrams because we want to make label claim after 2 years. Companies don't do that. This is, you got to understand the ethics and the morals in this world, especially in my opinion, post-COVID, have dipped dramatically, and you don't ever really know what you're getting. Now, I can't speak for what other companies do, but I know what we do. And we produce a clean product that's safety tested and that meets label claim on date of expiration. And a lot of products out there don't do that. And we know because we hear horror stories. On the backside of this, there's a whole backside to this. And when you go to conferences and other things, you see the horror stories, you hear about the horror stories of products that were contaminated or products that got recalled, et cetera. So, I can't speak for what other companies do. Our products aren't the cheapest because they're not poor quality and because we take extra care to make sure that when they reach you, they are absolutely what they say they are. So I don't know if that's helpful for you, but that's just the way we do things. Are there vitamins, minerals, et cetera, that help heal sprained ligaments and muscles? Yeah, to heal injured tissue, you need amino acids, especially glutamine and branched chain aminos. You need omega-3 to regulate the inflammatory process. You definitely need zinc and copper and vitamin C because those play a role in formation and strengthening and the flexibility of the collagen as you're repairing it in those ligaments, tendons, and muscles. So a lot of nutrients are required for injury. You might check out, we did a show, Jim, on surgical recovery. That show applies to sprained strains. So you might watch that show and you'll learn a lot about nutrition as it relates to healing and repair in that regard. What's the best support for traumatic brain injury? It just depends on why the traumatic brain injury occurred. If we're talking an acute traumatic brain injury, one of the best and most important things that you can do is get high doses of omega-3 fatty acids into that patient. So, like a stroke or a traumatic brain concussion, 6 to 8 grams of omega-3. Now, talk to your doctor about this, but that's, if my son had a traumatic brain injury or somebody in my family had a stroke, we'd be hitting them up with 8 grams of omega-3, high dose EPA, DHA for the first month to make sure that everything was there ready to heal and repair. What dose of B1 would you try for tremors? I'd start at 300 milligrams a day of benfotiamine, specifically benfotiamine and not thiamine. Thiamine's a water-soluble version of vitamin B1. Benfotiamine is a fat-soluble version. It's absorbed better, and it tends to work better when it comes to neurological issues. If you get exposed to mold, what would be the best method to detox it? I mean, if you had a week exposure, just like a week-long exposure, which looks like that's what happened to you, there may not need to be anything that you do necessarily extra. Go sweat it out. Now, if you're talking about chronicity of mold and you've been in mold for a long time, now that's a different matter. That's a different story. One of the things that we use to help bind the mold toxins out of people is something called mycobinder. Can we put a link up to mycobinder for Siren? So you might want to check that out. But we also use lipoic acid. And then we also have a formula called Ultra Liver Detox that we use to help people support their detoxification pathway. So those three would be really great places to start if you really are just looking to try a detox. Does ALA cross the blood-brain barrier? Yes. Is the European brand of ALA one of the? I don't know what you mean, Kenneth, when you say European brand. I mean, there's a lot of companies that produce ALA, but I think the brand that's best is the one that's pure, the one that's tested. Let's see. What's the difference between? I think I've already answered that question. Jessica, call the office, and they'll guide you on to the right electrolyte. Will your next big sale on INA cellular testing be for New Year's? Actually, Kristen, it's probably going to be Thanksgiving. What is it? Black Friday, Cyber Monday. That time framing. So, FYI, if you're looking to do that, yes, we'll have a sale then as well. We have a community called People Allergic to Me, people experiencing coughing, sneezing, sniffles around us. I've been researching PATM and ALA helped. You may be in a toxic environment where your clothes are picking up chemical toxins from your environment, mold toxins or others. And that when other people come around you, those things to those individuals are so concentrated that those individuals are having kind of allergic or immunological responses to you directly. That's a possibility. I would suggest if there's a whole group, I've not heard of that before. Thanks for sharing. But if there's a whole group called People Allergic to Me, you need to just share in that group that you all need to be tested environmentally. You need to make sure your environments are being tested for exposures to things that might be causing other people to react to you. I would also consider the potential, for asking in the group how many of those people have had, the jab, because there's a shedding potential as well, and we've seen that clinically that people with it sometimes will shed and make people around them not feel well. Debbie's asking if ALA is good for diabetics and does it help? And the answer is yes, it helps because it can lower A1C and it can lower blood glucose, and it can also improve insulin sensitivity. We talked about that on Tuesday's show, which I would encourage you to go back and watch. I have a question. Everybody keeps telling me buckwheat isn't. Is that a typo? It's got to be a typo. Buckwheat isn't weak. You mean buckwheat isn't wheat? I don't know if that's what you mean or not. Buckwheat isn't wheat. Buckwheat is buckwheat. Buckwheat is a pseudo cereal, and for many people with gluten sensitivity, they have what's called molecular mimicry cross-reactivity to buckwheat and don't tolerate it. But the other issue is like 42% of products on the shelf at the grocery store cross-contaminated with wheat, and we're talking about buckwheat products, and so you run a risk when you're using it. As far as the stab supplements, I mean, my go-tos are proteolytic enzymes and N-acetylcysteine when we're dealing with that kind of thing, Mickey. So we have a product called Matrozyme, which is a very potent blend of proteolytic enzymes. Combine that with N-acetylcysteine, 1,500 milligrams a day is a good place to support you. Back to buckwheat, I don't recommend it. So if you're following no grain, no pain, I do not recommend buckwheat as part of your diet. So, okay, I think we did it. We got an hour and change in. Look, if you're new to the show and you learned something, hit that subscribe, hit that like and subscribe button. Remember, the more likes we get, the more people can see this video. That's kind of the way I think they say it works. But look, if you like this information, come back next Thursday. We're here every Thursday from 12:30 to 1:30 Central Standard Time to take your questions live. I think I'm probably one of the few that do this. So take advantage of that knowledge and that time that we dedicate to you. In addition, if you want to support us, come over to Gluten Free Society. We have over 100 different supplement products there. If you're in the market for supplements and looking for high quality products, that's one way you can support our mission. You see me every week, but what you don't see are the 12 individuals behind the scenes that also help make this work happen. Additionally, come visit Gluten Free Society, sign up for our newsletter there. It's free. Can we put a link up for that as well? And we'll send you a bunch of information on how to overcome autoimmunity naturally with diet and lifestyle change. So thanks so much for tuning in. We'll be back Tuesday at 6 p.m. Central Standard Time for another crash course. Hope you have a fantastic weekend. Until then,